Gun violence is a public health crisis in our country that requires a public health solution.
Mass shootings are a weekly, sometimes daily problem across the United States, with people losing their lives to gun violence every day in this country. Now, the nation's top doctor, Vivek Murthy, is declaring gun violence as a public health crisis, citing statistics that show gun violence is the leading cause of death among teens and young children. It's also taking a toll on the nation's mental health, with nearly 80% of adults saying they stress about the possibility of being caught in a mass shooting, and half of the country's children worried about a shooting inside their school.
Murthy is also calling for doctors to promote gun safety education during regular visits. So what does this mean? To talk more about this, right now we are joined by Dr. Allison Brashear, the Dean of the Jacobs School of Medicine and Biomedical Sciences at UB. Dr. Brashear, thank you so much for joining us this afternoon.
My pleasure.
So first, let's just get your reaction to this declaration that gun violence is a public health safety issue.
I think this is a tremendously important move because gun violence has been in the public health area for a long time, but this elevates it. And we have believed here at the Jacobs School and in all the medical schools across the country that gun violence is really at a crisis, and that we need to not only prevent, but advocate for gun safety, and we have to identify those most at risk. We now know that guns cause the major cause of death of children and adolescents in the U.S.
Dr. Brashear, a lot of people are responding to this saying this is nothing more than a political move by the Biden administration. It's a campaign platform that the Biden administration is going to use in this election. So he directs his Surgeon General to make this declaration ahead, of course, of a presidential campaign. What does this actually do? What does Vivek Murthy's advisory actually do in the medical community? What does it change for you guys?
Well, it really elevates by, as you said, the top doctor calling this out and making this really a movement. Now, we at the Jacobs School have been working with our students and with other medical schools since May of 23. And we have developed a collaboration with other medical schools where we've exchanged students, and we have taught students as well as providers about advocacy. But I think this takes it to a new level. 52% of people in the U.S. have been impacted directly by gun violence. That's an extraordinary number. They've either witnessed it or been impacted themselves. So gun violence is not just the person who is injured or killed, but it's also the people who are witnesses or their children. And then it leaves a long trail of recovery, both from a mental health perspective as well as a physical perspective.
Dr. Brashear, I'm wondering why you don't think this kind of an advisory was made much, much sooner. Mass shootings, sadly and unfortunately, are nothing new in this country. Why do you think they didn't make this declaration, say, at the beginning of Joe Biden's term or another president's term, given the fact that, again, this is not new?
Well, I think that the physicians in the country have been calling for this for a while. And as I said, we and the other schools of medicine across the country have been really trying to put this at the forefront. So I'm glad that they did it. I think it provides a platform for education and also provides a platform for more prevention. I think now, since this has happened, it really puts a forefront. And I believe, that also happened with the opioid epidemic, right? So it really percolated, and then, Surgeon General came out and said, this is an epidemic and we must address it. And that led to a lot of renewed focus. Not only do we want prevention, education, advocacy, but we also want research and funded research in gun violence. What happens? How do we prevent gun violence? What happens to the survivors? And really, how can we make a difference, a real impact in this horrible tragedy that has unfolded in our country?
And Dr. Brashear, you mentioned, that platform for education. If you can, maybe backpedal a little bit, elaborate on what you're doing at UB to approach this with students.
So we have an elective in trauma-informed care We also have been having an exchange with Michigan State University students. Medical students came here in May of 23, and we had an advocacy and a remembrance as part of the Buffalo shooting. And then we actually sent students and had 10 other medical schools at Michigan State in February. They had a horrible shooting in their school. And then we will be having a similar advocacy and educational program here in Buffalo in 25. And so that has gotten a lot of energy from other medical schools that are interested in learning more about gun safety. And that means we're educating providers, the next generation of doctors who have this top of mind. Never did I think that a pediatrician's routine question would be, do you have a gun and is it locked up? We need to change that conversation.
Really good point. Dr. Allison Brashear is the Dean of the Jacobs School of Medicine and Biomedical Research at UB. Thank you, Dr. Brashear, for your leadership in our community, not only at UB, but also on this incredibly important topic. Thank you.
Thank you.